for me personally, is brought to you by Community Mental Health Education, presented by Space for Youth and WithYouth.ID in commemorating the World Mental Health Day that in October 10th in 2021. And personally, I'm supported by Indonesian Psychiatric Association and Lundbeck. Okay, and I'm the presenter. So this is my short CV. I'm a psychiatrist. I'm already married. I have 3 kids. And this is, you can see this, and let's skip this. This is just to validate that I'm a real psychiatrist and not just like some speaker you get in online on the internet. Okay, now if you're feeling sad or stressed or worried, confused or angry, it's very normal during time of crisis. And we are all now in a time of crisis. Pandemic, it's a global crisis because of the pandemic of COVID-19. So you are not alone. So if you have had these disturbing feelings, you are not alone, because there are some psychosocial impact of COVID-19 pandemic. Few among those are social contact limitations. Jadi pembatasan kontak sosial. The social contact limitation leads to changes in social interaction. Karena ada pembatasan kontak sosial, kontak fisik, sehingga interaksi sosial antara teman berubah jadinya. Sehingga it leads also to changes in lifestyles. Gaya hidup menjadi berubah. Masker menjadi satu keharusan. Kita tidak lagi melihat wajah-wajah, no smiling faces everywhere. It's all covered by masks. But we can see smiling eyes everywhere, because now we are more aware of eyes instead of the other features of the face because of the changes in lifestyles. And one more important thing in changes in lifestyles, and really actually disturbing to most of us, and maybe dan mungkin sebagian akan membahayakan mental health kita, adalah massive unfiltered information access. Jadi ada akses yang tidak bisa terfilter, tidak tersaring dengan benar terhadap informasi, sehingga all kinds of information, misleading informations or dangerous informations, or maybe just like hoax or etc. come into our life, and we can access it freely from the internet. And it leads sometimes to emotional numbness. So we try not to feel anxious about the information we read. And then we try, and then we develop an emotional numbness. Kita membuat perasaan menjadi tumpul. Oh, what that did? Because I don't want to care about those things that make me anxious. And these all lead to such serious mental problems. Now, you can see here. I give you data about how many people do self-checkup in our website in PDSKJI or Indonesian Psychiatric Association during 2020. There are 4,010 self-checkups about their mental health. Here you can see that 71% are women and 29% are men. And the data shows that 65% is conducting anxious symptoms, anxiety symptoms, ada gangguan cemas. 62% complain about depressive symptoms, and 75% complain about trauma. And the psychological problems mostly find in age group of 17 to 29 years old and the age group of 60. Why these two age groups? Because there are several reasons, but the data validate that young people are prone to mental health problems during the pandemic. So you might wonder, and I would like to explain a little bit, or a simplified version of how a mental disorder developed. Jadi, you became who you are. You develop your own personality. It's like a perfect mixture of genetic and psychosocial development. So you have your own gene passed on to you by your parents, but you are not your parents. So you develop your own personality by living and by developing yourself through stages of psychosocial development. Jadi ada genetik turunan dari orang tua, tetapi Anda tidak merupakan fotokopi dari orang tua. Instead, you develop your own personality dari perjalanan hidup dengan ada berbagai hal yang terjadi dalam hidupmu dan itu membentuk Anda menjadi seseorang dengan kepribadian tertentu. Nah, during lifespan, if there are external changes, internal issues, and physical problems, it will affect your personality. For instance, the pandemic, it's an external change. So the pandemic changed everything. And then there are internal issues like maybe you're feeling alone, or maybe you are feeling sad because you cannot meet your friends. And maybe you have contracted the COVID by yourself, so you have also the physical problem. And all those stressors affect your personality. Semua stressor itu mempengaruhi personality, and you might become stressed if you cannot have proper coping mechanism. Jadi kalau tidak ada mekanisme coping untuk mengatasinya, kalian bisa mengalami stres. Now, is stress a bad thing? No, actually, stress is something important in our life because if you can manage your stress, you can adapt to changes, you can be a better person. Because after you been through a hard thing and you've finally achieved something, your body, your brain will produce a happy hormone that makes you feel like you're something new. Jadi stress is something very important in our life. Without stress, we cannot develop to be a better person. So, for instance, if you think that you don't need people to tell you to do homework and you can do it by yourself, and suddenly I don't want to do it. But when somebody stress you or push you to do it, you can finally do it, and then you will be happy, feel happy about yourself. But there's a but. But if you cannot manage the stress and you cannot adapt to stress, or what do you call fail to adapt, then the mental disorder might happen. Okay, let's check out the story of Chitra.
Selamat pagi Bu Ina, barusan sudah saya email tugas makalahnya. Maaf terlambat, terima kasih.
Udah 2 kali loh ini Citra.
Maaf Bu.
Kalau sekali lagi, Ibu nggak terima tugas kamu lagi ya.
Tidak akan saya ulangi lagi Bu, terima kasih Bu. Namaku Citra, mahasiswi sastra semester 5. Untung selamat. Semenjak pandemi, kuliah diadakan secara online. Katanya kuliah itu masa-masa menyenangkan. Tapi sudah sebulan ini, yang kurasakan hanya cemas.
Dosennya masih mau nerima tugasmu, Nak?
Masih untungnya, Ma.
Jangan kebiasaan nunda tugas dong, Nak. Nanti bisa telat lulus loh.
Iya, Ma. Itu juga masalahku. Prokrastinasi. Sepertinya karena overthinking, jadinya mudah terdistraksi. Akhirnya aku lebih banyak ngemil dan nonton ketimbang nugas. Aku juga tidak ingin begini terus. Tapi rasanya benar-benar sulit untuk menemukan motivasi untuk nugas. Kangen di kosan. Ada yang temenin.
Halo, Beb. Kangen gak sama aku?
Belum kangen ah.
Wah, di rumah gemukan ya? Disuapin mulu sama mama papa.
Iya nih, Mer.
Tapi kok wajahmu murung sih?
Aku pun bercerita soal kegundahanku pada Mary. Tugas yang terasa berat badan naik terus, semuanya. Bingung juga, Mer. Padahal biasanya nggak begini. Mama pun sampai khawatir bisa-bisa aku telat lulus kuliah. Payah ya, udah umur segini masih bikin orang tua khawatir.
Aku ada saran nih Citra. Gimana kalau kita ke psikiater?
Psikiater? Enggak deh, aku belum parah kok. Aku nggak butuh obat.
Psikiater nggak melulu tentang obat kok. Ada juga sesi psikoterapi yang bantu menguraikan pikiran yang kusut. Lagi pula, jangan tunggu parah dulu baru berobat Citra. Aku pengen lihat Citra yang ceria lagi.
Oke deh, Mer. Aku coba. Aku pun sama.
Oke, ini aku bantu cariin psikiaternya ya. Besok kita pergi bareng.
Thanks, Mer. Aku juga ingin melihat diriku yang ceria kembali.
Okay, now generally speaking, Chitra is experiencing cognitive problems that affects her emotional stability. What do you mean by cognitive problems? So this is what I'm going to explain to you about, that depression is not only about being sad, but also having other aspects of the brain function. But mostly people are confused about what is depression and what is sadness. So the difference between sadness and depression is sadness is a normal feeling as a response to a bad or disappointing event or experience. It's temporary and it may reside over time after things get better or the problems resolve. It may recover by meditation, vacation, sharing with friends, and do some fun stuffs with friends, etc. And its sadness, you can pinpoint the cause. So maybe because of you're just having a bad relationship with your boyfriend, and you can directly pinpoint the cause that make you sad. But depression, it's a mental disorder. It mostly occurs without obvious trigger. The sad or empty feeling persisted at least within 2 weeks continuously. It cannot reside over time, but usually even worsen if not treated. So symptoms of low energy and motivation, sadness and emptiness are severe enough to disturb daily activities, social relationship, and productivity. So being sad, maybe kalau lagi sedih, you can be cheered up by your friends. But being depression, your friends might ask, "Lu kenapa sih?" And you don't have the answer to that because you don't actually understand why you're feeling sad. So that's the difference between sadness and depression. So depression isn't only about sadness. It has multidimensional symptoms. There are 3 main aspects of symptoms of depression. That is emotional symptoms, cognitive symptoms, and physical symptoms. In emotional symptoms, you can have the sad feelings, being anxious, easily agitated, you lose your kehilangan minat, you lose motivation, you have suicidal ideas, no hope, hopeless, and guilty feelings. In cognitive aspect of the depression, you can lose your attention and concentration, lose your short-term and long-term memory, and lose the ability to judge or think about and make decision over things. You lose your ability to organize things, your mental agility, your agility. And then in physical problems, you can feel easily get tired. You have eating problems, you have sleeping problems, and you have sexual function problems. You might have headaches and gangguan lambung, like people right now they say, "Oh, I'm having asam lambung or GERD," and you easily get feeling pain, and there are psychomotor agitation. So these are the symptoms of depression, not just mere sadness. Why is the symptoms occur? Because the depression happen by changes in our brain functional structure. Now our brain have parts of our have its own parts that have its own task to do. Like, for example, the striatum, it manages emotional memory and drive. Hypothalamus, it manages the sleep, appetite, energy, libido. The prefrontal cortex, it's the center of our cognitive cognitive function. So it manages the awareness and our judgment. The ventral tegmental area in the middle of our brain, it manages the joy, fear, motivation. Amygdala, it manages the emotional for the entire feeling parts. And the hippocampus, it contains the long-term memory. All part of the brain works and communicate each other by using the chemical, what called the neurochemical, called neurotransmitter and also neurohormone. The neurotransmitter and neurohormone are not just like, bukan neurotransmitter dan neurohormon, bukan hanya senyawa kimia yang biasa, artinya dengan sesuatu obat atau apa kita bisa memasukkan dan suddenly we feel better. It doesn't work that way. So actually the brain function in a way that you kind of use the brain use the neurotransmitter to communicate from this part of the brain to other parts of the brain. So patients with depression often report deterioration of cognitive functions, and there are 4 key domains of cognitive function. It is attention, memory, executive function, and psychomotor agility. These 4 domains of the cognitive function usually get disturbed when somebody is having the depressive symptoms. Now, some people are not aware, orang kadang nggak terlalu aware dengan adanya masalah kognitif dalam kondisi depresi karena menganggap bahwa depresi is only about sadness, but actually depresi is like your brain's function is being depressed or being stressed. Jadi fungsi otak secara keseluruhan tuh tertekan gitu. Jadi depression itu bukan aku tertekan, tetapi sesungguhnya all the function of your brain is tertekan. That's why all the aspect of your brain is affected. Now, do not self-diagnose. Do not say that, aku kayak Citra nih, berarti aku udah depresi ya dok. No, please understand the difference between screening and assessment. So if you want to know your mental health status, you do screening or assessment. Screening is risk factor identification. You can do it by yourself. It's simple, it's fast, and you can do it in general population. While assessment is used for diagnostic determination. It's complex, it took longer time to do it, and it's only can be done by professional. If you're doing screening and you got the point of mental disorder, maybe you have mental disorder. But if you got assessment from professional and they told you that you are facing a mental problem, then it is a mental disorder. And if you got your assessment, please do proper treatment and avoid self-treatment, because nowadays you can find antidepressant on like online shop, and it's not a good thing to do because it have to be done or have to be given by professional under strict dengan pengawasan yang sangat ketat. So between hesitation and necessity, when do you really need to see a psychiatrist? Now, if you're having psychosocial problem, you may feel sad, but unattended, prolonged, or severe condition can cause distress and disability to daily life and social performance, and it can go to further biological changes, akan membuat terjadinya perubahan-perubahan biologis yang akhirnya menyebabkan terjadinya clinical depression. Nah, primary support system pada tahap psychosocial problems like family and relatives might ease your problem. Jadi pada tahap ketika masih sadness, primary support system adalah satu benteng yang bisa membentengi seseorang, mencegah perkembangan menjadi kondisi depresi klinis. Di tahap selanjutnya, jika primary support system is kind of fail, or maybe you're having your stressors back at home, there are social environment, your friends, communities. But if it also fail, you can find a counselor. A counselor can be a religious leader, can be a psychologist, and also can be a psychiatrist. So seperti kayak komik Citra tadi, psychiatrist is not all about medication or drugs. They can also give you counseling, psychotherapy, and so on. And if there's a clinical depression, because there are biological changes in your body, you must see a doctor, you must see psychiatrists. The second reason why you should meet a psychiatrist, because the way our body function is very complex. Jadi tubuh kita berfungsi dengan sangat kompleks. Kita tidak bisa mengatakan bahwa ketika seseorang merasa stres, ada beban pikiran, that's the only way people can get mental problem. No, there are other ways people get mental problem. That is organic mental disorder. Jadi, for example, if you're having infectious disease and it goes into your brain, you might have the features or symptoms of mental problems, but actually it's called the organic mental disorder. And there are what you call the psychological stressor. It became a functional mental disorder, but because it goes into your body, the brain, jadi otak itu akan mempengaruhi peripheral and autonomic nervous system. Kemudian peripheral autonomic nervous system akan mempengaruhi sistem imun. Sistem imun mempengaruhi sistem endokrin yang membuat hormon dalam tubuh kita. Contohnya orang dengan stres bisa haidnya jadi nggak teratur. Dan akhirnya gangguan hormonal ini akan balik membuat beban pada susunan saraf pusat atau otak kita. Jadi otak kita nggak berdiri sendiri because our brain is inside our body. So everything our brain yang terjadi dengan otak kita, our body will feel it too. So if the symptom goes to our body, the symptom of mental distress, that's when you should see a psychiatrist. For example, muscle tension, sweating, heart pounding, short breath, stomach discomfort, loss of focus, and so on. The third reason why you should see a psychiatrist is treatment approach for mental disorder only conducted by person with suitable competency. And in the early stage tadi, seperti yang tadi sudah kita lihat bahwa di tahap-tahap awal bisa dilakukan sosioterapi. Nah, people in the society can do this. There are trained social worker, GP, nurses, and psychologists. Like maybe the community, like Space for Youth, yang menyediakan layanan konsultasi buat teman-teman yang mungkin ingin chat dengan Auximate, itu termasuk dalam sosioterapi. Seseorang yang membutuhkan bantuan hanya untuk ngobrol bisa di tahap society. Tetapi jika tahap orang tersebut memiliki gejala yang jauh lebih berat, they should see a counselor or a psychotherapist. This only can be done by trained social worker, GP, nurses, psychologists, psychiatrists, and psychopharmacy atau obat-obatan only can be given by general practitioner atau dokter and a psychiatrist. And there's another way of treating mental disorder by brain stimulation is only can be done by psychiatrists. So this is the treatment guidelines for antidepressant therapy because you want me to speak especially about antidepressant. So this is the treatment guidelines. Antidepressant not suddenly given to everybody. It only been hanya ditawarkan, hanya dianjurkan untuk diberikan pada depression with moderate severity level. So like we can see here that the antidepressant determination, penentuan bagaimana kita memberikan antidepresan, we have to do a thorough clinical assessment. Nggak bisa sembarangan, tidak pemeriksaan dulu. Nah, harus ada pemeriksaan secara menyeluruh untuk memastikan diagnosis bahwa memang pasien tersebut membutuhkan antidepresan. Dan kita harus tahu the medical comorbidities, artinya penyakit-penyakit penyerta lainnya ada nggak? Mungkin ada anak-anak dengan asma dan lain sebagainya. Kita harus menjadikannya pertimbangan. And we have to know the previous treatment. Kalau mungkin orang tersebut sebelumnya udah pernah dapat antidepresan. Now, this one point is very important. We have to discuss our options. Karena opsi dari pemberian antidepresan atau pemberian terapi pada depresi itu sangat banyak. Not only antidepresan, but also psychoeducation, psychosocial therapy, psychotherapy, Ada banyak pilihan. Dan pilihan ini harus didiskusikan not only with the patient, especially for youth. It have to be discussed with the family. So please don't find help by yourself. If you are a youth, you're under the guidance of your parents. You should come with your parents or older people that know your condition very well. Nah, dalam penentuan juga, we have to know the patient's perception and preference. Jadi pasien pengennya minum obat yang pagi atau malam misalnya. Oh, kalau pagi dok, nanti sekolahnya gimana? Oke, minumnya yang malam. There are various kinds of antidepressant. We do laboratory checkup when needed, and we discuss the possible side effects, and also we discuss the cost. Jadi kalau harganya juga terlalu mahal and the patient cannot continue the antidepressant, it will not do good for the patient. Jadi we have to discuss also the cost in the ketika awal kita akan menentukan antidepresan yang diberikan. And then we have to evaluate the response. The initial evaluation conducted within 2 to 4 weeks. Initial response to therapy is a predictor of non-responding cases, and response to therapy is defined as 30 to 50 reduction from initial depressive symptoms. So why antidepressants? Like I said before, the problem of depression is not only like the molecular or the imbalance of some substance in our brain. It's not only about our brain, because when our brain is not doing very well, the whole body will feel it. Because why? Because the substance that's used for the brain to communicate with each other is used for the brain to communicate with our body. Jadi senyawa yang digunakan oleh otak untuk berkomunikasi antar sel-sel otak itu juga digunakan untuk berkomunikasi dengan sel-sel tubuh yang lain. So tidak sesederhana ketika kita mengatakan using antidepressant is not simply adding up some chemical substance to the brain due to chemical imbalance and voila, the symptoms reduce. It's not as simple as that. Antidepressant induce neuromodulation as well as having neuroprotective and neuroplasticity modalities. Jadi antidepresan ini bukan hanya membuat seseorang terlepas dari kondisi depresi, tetapi memiliki efek perlindungan dan efek juga memperbaiki sistem saraf otak. That's why antidepressant takes time to fully work and not working instantly. Jadi dianjurkan antidepresan dikonsumsi untuk jangka waktu tertentu karena it's not instant. Karena efeknya adalah untuk memperbaiki sistem saraf dan bukan untuk sekedar seperti penenang. Minum penenang, wah relax. Begitu efeknya hilang, langsung gelisah kembali. So antidepressant is not like that. The brain communicates with the body by neurotransmitter and neurohormones. So adding antidepressant as treatment options accelerates recovery instead only psychotherapy alone. Jadi kalau Anda memilih kita ngobrol-ngobrol aja atau yoga aja, it helps. Tetapi perjalanannya akan lebih lambat ketimbang dibantu di tahap awal dengan antidepresan. So, for the conclusion, depression is one among other mental disorder. The cognitive disturbance manifestation is common among other depressive symptoms and can severely affect the quality of life of people with depression. Depression is not a sign of weakness because depression can be managed, treated, and recovered. Support from family and closest friends can help the recovery of people with depression. I think that's my presentation, and I hope we can gain more information during the discussion. Thank you, Shakira.